Hey everyone, I'm sorry I can't be there today, but thank you for coming to listen to my talk about infectious diseases in effective altruism. So I'm going to talk about the big three. These are tuberculosis, HIV/AIDS, and malaria. There's no natural immunity, so it's hard to develop vaccines for them, and they kill a ton of people every year. So as you can see, people have been dying of these three diseases less and less over time, and DALYs, or disability adjusted life years, is a vague measure of suffering, and those have been going down too. But you can see how suffering or the ways in which these diseases disable people and compromise their lifestyles are very different for the three. So HIV/AIDS is particularly nasty, for example, and even though malaria mortality is low, it's pretty competitive in terms of how much disability it causes. People die of infectious diseases more often when they live in low-income countries or less developed countries. Here I've disaggregated the causes of death in high sociodemographic indexed countries versus low, and as you can see, in terms of both deaths and DALYs, infectious diseases, plague, or communicable diseases plague lower income countries more. So it would arguably be more cost effective to have a kind of health intervention in a lower income country than a higher income one. So COVID-19 has thrown a real wrench in the works. Bunch of services. This is a chart of the Global Fund's supported services and health centers for the big three diseases have been compromised to this day. 66% of both TB and HIV/AIDS clinics have been disrupted in their service provision. These are the number of excess deaths expected to occur because of the big three due to disruptions like these. So it's not a good time in the fight against the big three. These kinds of disruptions take many forms, including fear and mistrust, reduced general health communications, and so on. I encourage you to look at these slides later. I gotta move. Looking forward, the big three are going to get worse. With the climate crisis, we're expecting 140 million climate refugees in cramped conditions, so you're going to have infectious disease spread. Malnutrition caused by COVID, we're expecting more than 270 million people to be hungry by the end of 2021. When you're malnourished, your immune system's low, you're more likely to get an infectious disease. Conflict is going to increase as people get more sick. I can direct you to a couple of papers on that. HIV/AIDS correlates with conflict, which is wild. But there is technological progress. We're trying to find ways to kill malaria-carrying mosquitoes, and strategic health diplomacy. More and more people are recognizing how donating money to improve people's well-being is good for you diplomatically. Public opinion increases, and so on. I'll get to that in a minute. So in terms of how EA approaches infectious diseases right now, they say that the greatest benefits of working in this and working to prevent it are the flow-through effects. So when someone is less sick, they're more likely to work harder, contribute to the economy more, and all of that. The chain effects are amazing, and EA recognizes that. There's a recognition that it's neglected, and earning to give may be the best way to do it, because a lot of the interventions are very technically specific and require a long duration of study. But EA also acknowledges that, so all of this is from 80,000 hours, by the way, cutting-edge technologies are going to really support people in the long-term future by preventing new diseases, and everything about this field could use more additional funding and talent. I don't see that very often, but it was exciting to find. So thinking about scale, neglectedness, and solvability, the scale is massive, accounting for our inherent scope and sensitivity. I've put some stats. Every 20 seconds, someone dies of TB. Every 2 minutes, someone dies of malaria. And every 5 minutes, a child or adolescent, under 19, dies of HIV/AIDS. The economic burden, even if you're a heartless person, is intense. These are trillions of US dollars cost to the global economy every single year. And these are the leading causes of death globally as of 2019. And among the top 10, 3 of them are infectious. So the scale is massive. We could save a lot of lives by giving people pills and telling them how to protect themselves from diarrheal diseases and so on. Neglectedness. Infectious diseases need a lot more attention and talent, as 80,000 hours admits. These are correlations between the disability-adjusted life years and the funding that the U.S. puts into research into these infectious diseases. You can see the big three up here, as I was talking about. But you have a lot of stuff. There are a serious number of outliers. Like tetanus, for example, down here gets no funding, but is really bad in terms of DALYs. If we measure how much investment goes into each disease per death, you can see a lot of money is going to HIV/AIDS to try to prevent, given the amount of money going into prevention and treatment versus how many people are dying, TB is especially neglected. We need to be putting more money there, and out of all of the money that we give foreign aid-wise through USAID, most of it's going to conflict, peace, and security. And then we get HIV/AIDS, and then we get everything else for health. So if we look at neglectedness in terms of foreign aid, not doing so hot. And then we can solve it. Isn't that exciting? All of these diseases, 2025, 2030, 2050, we can get rid of them. The question is, how do we gauge our impact? You can do quantitative, 50,000 people fewer died. Qualitative, a bunch more people are, making advancements and contributing to the society now that they're healthy again. But you also have to think about chain reactions, and return on investment is amazing. The sum, if you invest in some organizations like the Global Fund working on all big three, every dollar you put in has a return on investment for the society, civil society organizations, educational attainment, and so on of $19. So there's amazing return on investment. And then you have to think about presenting your results in a way that's going to be compelling for people not in EA and people who might care more about the humanitarian aspect than maybe the burden on the economy, or vice versa. So some questions to consider just to wrap up. Do you think global health and/or infectious diseases merit more attention in the EA community? To what extent would accounting for equity and equality, which are back here, something we need to think about and don't talk about enough in EA? Here's a little chart showing how you can conceptualize these. Equality is giving everyone a box, but you're not addressing the problem. Equity is giving everyone the right number of boxes, which kind of fix the problem, or you can get rid of the systemic barriers, making people sick in the first place. And with EA, we're much more focused on equality than we are with equity or justice. So, given that, if we accounted for these things, would we be more effective? Is this something we should care more about in the EA community if we know it would help in the fight against infectious diseases? And finally, how do we measure the impact of chain reactions? Thank you very much for your attention.